Initiative, but still coming through in the program at 7:30 this morning will be our usual segment of What's in the Papers. So we get to analyze and discuss some of the issues that have been published in today's newspapers. A lot of things happening in the country.
Absolutely, lots happening indeed. Despite all the negativity regarding health, etc., and COVID, we are still quite busy. And we do have, although having said that, the COVID-19 pandemic has also opened up a rather weird space, and that is one where people are perhaps taking advantage of this pandemic and supposedly coming up with so-called remedies or potions, I guess is a good word.
Potion sounds like a good word.
Yeah, potions. And as a result, some people are actually, falling for this kind of thing, and it is affecting people's health, etc. So we do have a very special feature brought to us by one independent journalist from the BBC who went and did a bit of research, all in a bid to try and expose this element or this face of COVID, because COVID-19 has different faces.
Yeah.
This is just another face.
Absolutely, there's a whole world of quack doctors out there.
Yeah, they're called quack
doctors, because in accordance to the WHO, over 100,000 people lose their lives on a yearly basis, basically because they have taken in fake medicines. So Anas Aremeyaw, is based in Ghana, but he goes around the world disguising himself as different people to try as much as possible to expose,
to extract information.
To extract information and to expose these criminals. He's a BBC investigative reporter, but he has brought us this. Rather, I had a conversation with him, and he talks more about the documentary, which he has actually released.
Imaoneka nanga bakana BBC interviews.
Oh, Napita.
You've arrived.
I've arrived.
All right, well, let's have a look at this great interview that Yanko had with Mr. Anas.
In Africa, deaths from coronavirus have been some of the lowest in the world. But the fear the COVID-19 pandemic has created has also been an opportunity for some people, an opportunity for fame.
Let there be discovery of vaccines, discovery of medical cure, let there be discovery of total eradication of coronavirus.
An opportunity for making so-called cures.
If you take it from me, you are going to use it. I have 100% confidence.
Yeah, rather than COVID.
Yeah.
No more.
Oh,
the cure.
It's beginning.
An opportunity to make money.
Fake medicines have profit margins sometimes equivalent or more than narcotics.
150,000. 150,000. Okay.
I am undercover journalist Anas Aremeyaw Anas. I keep my face and my identity secret to protect me from the crooks I expose. I have been investigating quack doctors in Ghana, men who illegally sell concoction they claim can treat coronavirus. Products we discovered that contained potentially dangerous and toxic ingredients.
The Corona Quack documentary is simply about people who are taking advantage of the poor in the society and milking them off dry using corona fake medicines. It starts off in Nigeria, where we meet a pharmacist who claims to have a cure not only for corona but also for AIDS, hepatitis and other things. It also looks at a herbalist in Nigeria and another religious leader in Nigeria. All these people claim they have cure. For what we know, there is apparently no cure. I move on from Nigeria and come to Ghana, where I look at two main people, Core FX as a company and the Abdallah Brothers as a company. Both of them claim to have COVID cures. I go behind the scenes and realize that though Core FX has written on their website that they have no cure, they don't cure corona, when you move into their office, one of the agents was very clear and categorical, told me that they don't only cure corona, they also gave me a prescription that shows how I should take that medication to cure corona. the Abdallah brothers was even much worse. They would mention names of big people who they claim have come to buy the medication from them. They mentioned ministers. In fact, even said that the deputy president or the vice president of Senegal had requested to buy some of the items. All this just to pull wool in your face, pushing you to want to buy that particular product. But in all this, I carried this evidence to the Food and Drug Authority and also to the Ghana Standard Authority to check whether it is wholesome. And in the investigation, you see me go there and I put it before the microscope. You realize that all is not just unwholesome, but contains substantial amounts of yeast infection and then mold. Also, both products contain sulfine, something that we know is not good for human consumption.
Okay, it's on record that the Ghana government has put in place stringent measures to safeguard its people against corona. How are they able to do this?
Well, yes, government cannot have eyes everywhere, and corona puts us in a very panicky situation, a disease that has no cure, and the fact that it has no cure, it pushes people to do all sorts of things. So yes, in spite of government measures, there was a need to look beyond and to find out what else people are doing. The Food and Drug Authority, which is the regulatory authority for all these fake medicines, cannot be everywhere. Don't forget that fake medicines across the world kills over 100,000 people. So, across the world, and in Africa kills over 30,000 people. So, as we speak, fake medicine has killed more than corona. So, it is not about government's ability. It's about all of us waking up and saying that, hey, this is a new pandemic. There are going to be people who will take advantage of this pandemic, and then we have to stand up and deal with them and tell society to eschew from buying such quack medicines.
Well, so what effect has COVID-19 had on Ghana, broadly speaking?
Well, COVID-19 has had devastating effect on Ghana. Some very senior politicians have died as a result. Senior doctors have died. Frontline workers are suffering. Ordinary citizenry are suffering. So generally, it's not good. But I would commend efforts that have been put in place to stem the tide. Most of this effort will depend on the citizenry, how we all decide to practice safe distancing, how we all decide to wear our face masks, wash our hands, and do everything that needs to be done to ensure that COVID does not spread.
Okay, these so-called doctors, is this their first order?
Is it their
first order? I'm sure they mean, is it their first attempt, or is it the first time that
yes?
Fake doctors?
It's when you look at core effects, before we even did our story, you realize that the FDA had issued a statement that their product, which is a food supplement, was not unwholesome and contained E. coli. E. coli are remnants of feces. Then the Abdallah brothers, when we went there, we saw that people had queued. So it is the advantage that these organizations seem to take from ordinary citizens that hurts, because people are confused in this state. They want solutions to their problem. They are getting sick every day. And if at least you are not finding a cure for them, don't introduce new diseases into their system. So yes, in spite of all that, one would say that it will not be their first attempt, just by their own admission that they've cured many people, they've given this substance to people. Clearly, they were in the business and the act of conducting this fake medicines.
Less than 24 hours after our interview, the FDA moved to shut down the production facilities of the Abdallah brothers. They had been on their radar for some time now. The agents found evidence of large-scale production, including almost 300 bottles of so-called COVID cures. Dr. Abdallah Jr. repeatedly tried to persuade the agents he was not selling these concoctions.
Well, we have not sold this thing in any way or the other. We have not sold them out to anybody.
But what you have here is in commercial quantities.
We made that in this quantity in a sense that We are waiting for when the approval comes. Bro, we did not intend selling.
When asked to explain why a fake FDA number was on the labels, he had no answer.
Well, this number
TNPC number without FDA number. So that's the difference.
We sent our allegations to the Abdallah brothers, and they responded, claiming their product was for testing purposes only, and that they are taking steps to license it. They claimed they never said their product can cure coronavirus, despite it being labeled COVID cure. They also claimed they had never sold their concoction to anybody. Kwa FX and Samuel Atudankan did not respond to our allegations.
Cure for coronavirus. This is where we are. That is why we invited you.
Was this operation risky like your other risky operations?
No, this I would say was low level risk. It's something that we all strategically planned for, and the level of risk, the only element was risk was when the FDA was going on their operation, but they were leading it. Anything could have happened in that bush, but I mean, it was all under control because the men who worked on it were very professional.
When is the next time we'll hear about another Anas expose?
Well, that's a very difficult question to ask. I don't know when my next expose is coming, but I can tell you to stay tuned because even this, it is in two parts. The BBC has aired the first one, it will air the second one at a date that will be announced to you. All of you focus and stay tuned with Africa Eye. Go click on our stories and watch them. The best is yet to come. Thank you.
All right, thank you.
The individuals exposed in this film do not represent the herbal medicine industry as a whole, which provides crucial services to many Ghanaians. Professor Gordon Awandare hopes herbalists and scientists can unite in rooting out the rotten eggs.
You have a few quacks there who they really do a disservice to the industry and to their colleagues, which is unfortunate because there may be some that actually are good. If we don't get rid of the fake ones, then you have a situation where people mistrust the whole enterprise.
At a time of global pandemic, we have a duty as journalists, as citizens, to fight fake medicines and expose the quacks that mislead us. I will always be watching.